Is your nose stuffy all the time? Maybe some tips or hacks you found online worked, but only for a few minutes. In this video, I'll reveal how you can breathe much better through your nose for much longer periods for long-lasting results. In my past videos, I talked about natural or simple ways to unclog your nose, but most of these methods only last a few minutes or hours at best. In this video, I'll describe 7 long-lasting or more permanent solutions. These methods will involve over-the-counter sprays and pills, devices, gadgets, or even surgery. Stick with me to the end and I'll reveal what you should do if you're breathing much better through your nose, but you still can't sleep any better. Hi, I'm Dr. Stephen Park, an ENT surgeon and sleep medicine doctor with a passion to help you breathe better and sleep better so that you can wake up refreshed, ready to take on the world. Many of you are still struggling to breathe better through your nose. If you haven't tried anything yet, please watch my other videos on simple and conservative ways to unclog your stuffy nose, which I'll link to below. If you already tried everything online but want answers to a more permanent solution, you're in the right place. I'll start with conservative options and move on up to more aggressive ones. Number 1, the first long-term solution is nasal dilator strips or any internal dilator device. The most well-known name for these dilator strips is Breathe Right, but you can find dozens of other generic variations online or at your local pharmacy. Personally, I use a generic brand from Amazon every night to help me sleep much better. These devices are adhesives with a built-in soft plastic spring that keeps your nostrils from caving in whenever you breathe in through your nose. You can use this during sleep or even when you're exercising to maximize nasal breathing, like what you see in football. The instructions say to place it at the junction between the lower third and 2/3 of your nose, but you have to experiment to get the best results. Now, there are a few issues that come up. Depending on how oily your nose is after you wash your face, the tape can come off too easily, or it may stay on too strongly and peel off some skin as you take it off. I found that if I wash my face twice before bedtime, the tape will peel off a small portion of my nasal skin. So now I know when and how often I have to wash my face. Also, you may not be able to find the right size in the pharmacy. In most cases, it's going to be too long. In this case, you can use scissors to trim the ends to make it fit your nose better. Another way to keep your nostrils from caving in are devices that go on the inside of your nostrils. They come in various names and configurations like Mute, Nosevent, and AirMax. These are 3 popular brands. Unfortunately, it's hard to know whether or not it's going to help your nasal breathing without trying it first. The other issue that some people have is how sensitive you may be to having something inside your nostrils. Some of these devices can go quite high, above the slight crease on your side wall of your nose. Above it is the upper lateral cartilage and below it is the lower lateral cartilage. Most cases of flimsy nostrils happen because of collapse of the upper lateral cartilage. Sometimes you have both upper and lower lateral cartilages collapsing together. So in general, the higher up in your nose, the better it works. If you can't keep it in all night, or if it falls out at night, then it stops working. So the bottom line is that with these variations of nostril stiffeners, you have to experiment to see which one works best for you. Once you're breathing much better through your nose, one thing you may wish to consider adding is to tape your mouth closed. I talk about the potential benefits of mouth taping in another video that I'll link to below. Number 2 are nasal decongestants. They come either in a pill form or sprays. These you can get over the counter. The little red Sudafed pill is 30 milligrams and that'll give you about 4 hours of decongestion, and the 12-hour version usually is a long white pill. They work by shrinking blood vessels in the nose. It mimics epinephrine like when you're under stress, and because of this, it can potentially raise your blood pressure. Also, if you take it too close to bedtime, you may not be able to fall asleep. Pseudoephedrine is actually kept behind the counter at the pharmacy since it can be illegally converted to methamphetamine. Although these medicines do work, they're probably not worth using in the long term. These ingredients are also mixed in with various other cold and allergy remedy ingredients, such as acetaminophen, Tylenol, ibuprofen in Advil or Motrin, as well as antihistamines and mucus-thinning expectorants. So you have to read the ingredients carefully. Antihistamines alone don't help with nasal congestion, so that's why they add the letter D for decongestant. Decongestant sprays also come in 2 dosing variations. Oxymetazoline lasts for up to 12 hours, and phenylephrine lasts for about 4 hours. You'll see dozens of brand name variations such as Afrin or Neosynephrine. The problem with these sprays is that if used for more than a few days, there's a chance of rebound, where the effect wears off and you have to use the spray over and over again. These sprays also have a potentially dangerous preservative called benzalkonium. These are also the sprays that people get addicted to. So if you are addicted, go see an ENT ASAP. The next 4 options involve surgery. It's important to point out here that it's rare that one of these procedures is done by itself. Most nasal congestion that doesn't respond to medical therapy is usually due to a combination of different reasons due to what I'll describe a little later. Number 3, you can undergo a septoplasty operation. There are a lot of myths and misconceptions about what a septoplasty is amongst the general public and on the internet, and even with most doctors in general. First, let me explain why people get deviated nasal septums. Let's start with some basic anatomy. The word septum means a dividing wall. You have many other septums in your body as well. Your nasal septum is the midline plate of the cartilage and bone that separates the right and left sides of your nose. The front part is what's called the quadrangular cartilage. This is what you can feel when you wiggle your nose. Towards the back on top is the perpendicular plate of the ethmoids, which is a bony plate. Along the bottom towards the back is a triangular piece of bone called the vomer. Now I'm going to describe why people have deviated nasal septums, something that you won't see or hear about anywhere else. As you'll see, it makes total sense. Most doctors learn that it's from trauma to the nose during birth coming out of the birth canal, but we see people with deviated septums all the time who are born by C-section. Plus, in general, you don't see deviated septums until you're a teenager or an adult. You can also believe that any kind of physical trauma can cause a deviated septum, such as being punched in the face, but that's been shown to cause buckling of the septum in a vertical direction like this. Most deviated septums curve horizontally like this. So what you see is that the most severe part of the deviation happens where the cartilage and the vomer meet on this line. So what causes this to happen if there's no trauma? In my book, Sleep Interrupted, I read about how modern humans, from a change in our eating habits and infant feeding methods, our jaws are shrinking and our teeth are getting much more crowded. This is why younger people these days have more triangular lower faces. If you look at some of the movie stars before the 1950s, you see that they had very wide faces compared to more modern faces. I talk about all the different reasons in my video why your face is shrinking, which I'll link to below in the description box. This is why it's a given that almost everyone will need their wisdom teeth taken out, whereas over 100 years ago, this was rare. And now it's a given that you'll need braces. So how does this lead to a crooked septum? During early normal development, the upper molar should widen as the roof of your mouth, the hard palate should drop like this. With modern faces, this isn't happening as much, so you're left with narrow jaws and a high arched palate. Inside the nose, the nasal septum sits on the middle of the hard palate called the maxilla. If the hard palate doesn't drop, then as the septum grows, it buckles to one side. And where it buckles is a junction along the upper border of the vomer where it meets the cartilage towards the front and the ethmoid bone in the back. Now that you know why you have a deviated septum, let's talk about the septoplasty procedure. The septoplasty operation is one of the most commonly performed procedures by ENT surgeons all over the world. It's also one of the most misunderstood procedures by patients and lay public alike. First of all, a septoplasty is not the same thing as a rhinoplasty or a nose job. And the term septoplasty means modifying or changing a septum. This can be done for breathing problems because it's crooked, but it can also be needed as part of a cosmetic rhinoplasty in addition to the nasal bones. And just because you have a deviated or crooked nasal septum doesn't mean that you need surgery. Only if you can't breathe and you've tried every conservative option should you think about surgery. There are many different variations of the septoplasty procedure. One maneuver that's common to all the procedures is that you have to peel off the mucous membrane and the underlying thick fibrous layer called the mucoperichondrium off the cartilage and bone on both sides. This is done to get to the crooked portion of the septum. This is usually done by starting with an incision or a cut on one side of the nose to get access to both sides. This is like doing keyhole surgery, either directly with the naked eye, using magnifying glasses, or video endoscope. Not one is better than the other, it's actually the surgeon's preference. Personally, I prefer doing it with the naked eye since I can finish the procedure much faster. Typically, you have to remove the bony spur that juts to one side of the vomer or maxilla and whatever cartilage is crooked, and place the mucous membrane flaps back and press it together using nasal tampon-like packing with or without plastic splints. This will allow the wound to heal without a blood clot collecting in the middle. Personally, I prefer not to use any packings or splints. Instead, I use a dissolvable coating stitch going back and forth on both sides to sew the mucous membranes together. The reason why I do it this way is because of studies showing that nasal packing causes sleep apnea. Patients are much happier and recover faster, and I've had no serious complications as a result. But it's not wrong to do it the traditional way using packs or splints. Number 4. Now let's talk about turbinate procedures. Turbinates are like wings. They smooth, warm, and humidify air that you breathe in. If you're blocked for whatever reason, the nose can't do its job. Turbinoplasty means modifying the turbinate, and turbinectomy means removal, whether it's partial or total. You can also debulk, shrink, or scar the tissues under the mucous membranes. And there are lots of variations, techniques, and equipment that are used. In the old days, surgeons used to remove some or all of the turbinates, but in the past few decades, the pendulum has swung to the conservative side with minimally invasive mucous membrane sparing procedures. The vast majority of these procedures are done by placing a thin instrument through a puncture hole in the front and cauterizing, dissolving, or scarring the vascular tissues between the mucous membrane and the bone. Many surgeons also use what's called a suction microdebrider, which is like a mini roto-rooter that has a sharp blade that rotates and spins and cuts along with suction. Turbinate bone is rarely removed anymore unless there's a good reason to. The end result after healing is that the soft tissue is smaller and any allergies or colds won't block the nose as much as it used to if it swells. If you had a septal operation, then the results would be even better. One legitimate concern about turbinate surgery is the small risk of empty nose syndrome. This is a huge subject that leads to very strong opinions and emotions. Fortunately, I've not seen any cases of empty nose syndrome, even in my early career over 20 years ago when I was doing more aggressive turbinate resections. And interestingly, as part of our field, we occasionally perform what's called a medial maxillectomy, where the entire sidewall of the nose, including most or all the turbinates, are removed for potential cancer. As far as I know, there have been no reports of empty nose syndrome in these patients. Another interesting finding that I saw in my practice was that in every patient that came to see me with an empty nose syndrome diagnosis, they all had severe upper airway collapse with their nostrils or further downstream in the throat, whether it was a soft palate, tongue base, or epiglottis. Many of these empty nose syndrome patients' symptoms looked identical to what's called UARS, or upper airway resistance syndrome. With a few exceptions, the few dozen or so patients with ENS responded relatively well by treating their UARS. My theory is that by dramatically lowering nasal resistance, it leads to increased airflow, which can narrow a collapsible tube either upstream or downstream. It's like sucking in through a flimsy straw. The harder you suck in, the more collapsible the straw becomes, especially in the weaker areas. And this can lead to sudden microarousals causing sleep fragmentation. Technically, these obstructive episodes won't be for more than 10 seconds, so it doesn't show up as apneas on sleep studies. Over the past 20 years while I was in practice, I saw more and more persistent nasal congestion despite turbinate surgery. I think ENTs in general, including myself, shifted over to more conservative options with better technology. But did this happen at the same time that awareness of ENS increased because of the internet? There are now even some sites that caution against touching the turbinates at all, even using the most conservative procedures. I can see why surgeons are being overly cautious. Patients who suffer from ENS have legitimate symptoms, and we need to take them seriously. It's odd that ENS was much more rare 30 to 50 years ago, and now it seems to be much more common. Is it because of the internet? Perhaps. However, if you consider the fact that modern human faces and nasal cavities have shrunken significantly over the past 50 years, it's no wonder that we're seeing much more of this condition. Number 5 is nasal valve or nostril surgery. When you think of nasal surgery for congestion, most people, including ENT surgeons, will think about treating the septum and turbinates only in the beginning. You can do a great job internally, but if your nostrils are still caving in when you inhale, you still have a stuffy nose. One way you can test to see how much of a problem you have with flimsy nostrils is to press with your fingers on both sides of your nose just beside the nostril, push in and lift the cheek skin up and out. Now breathe in. Another way is to place blank ends of Q-tips in both nostrils and lift up and out. And you have to make sure to place the ends above the crease line, which is right here on the nostrils. This is called the Cotton maneuver, and if you can breathe really well, then it's positive. You can get similar results using nasal dilator strips or internal devices, which I talked about previously. However, it won't be as dramatic as with the Q-tips. If you have a positive Cotton maneuver, or if you're happy using something to stiffen your nostrils at night, you can keep doing it. But if you don't want to use these devices for the rest of your life, then there are a number of surgical options. Usually, flimsy nostrils don't happen by themselves. You also have a deviated nasal septum and large turbinates, as well as narrow jaws and nasal width. So if you see an ENT, you'll most likely be offered a septoplasty and turbinoplasty first. But if it doesn't work, then see if your nostrils are still caving in. Another way of knowing if you need to perform the nostril operation at the same time as a septoplasty is by spraying some Afrin decongestant spray. And this will temporarily simulate a septoplasty and turbinoplasty. If you can breathe in much better, then hold off on the nostril procedure. If your nose is still stuffy after the spray, but lifting up your nostrils makes a huge difference, then you can consider undergoing a procedure to stiffen your nostrils. Or you can keep using your nasal dilator device. So what are the options for nostril surgery? The procedure code that's used sometimes falls under a rhinoplasty procedure, but with good documentation, it can usually be covered by an insurance company. There are two in-office surgical options. In general, they won't be covered by insurance because they consider them cosmetic procedures. The first one is called the lateral procedure. Your nostril is first numbed with Novocaine, and a small needle is placed through your nostril from the inside, and a thin woven polyester rod implant is threaded vertically along the side of your nose, just under the skin. This creates more stiffening as it heals. The other option is what's called vivair, where radiofrequency energy is applied on the inside sidewall of the nostril. With time, the nostrils stiffen, and it's also done under local anesthesia. Then there are three other options that can be done in the operating room, but also local anesthesia with sedation, depending on the surgeon's preference. In theory, these should be covered by insurance as long as there is good documentation that all other medical methods failed, especially having tried using a nasal steroid spray. The more traditional method is done using what's called an open rhinoplasty approach, which is what's used for certain cosmetic procedures. Here, you're actually doing plastic surgery, but for medical reasons. The skin of the lower 1/3 of the nose is peeled off, and cartilage that's been harvested from the ear or even the septum can be used to place a thin layer over the area of the nostril that caves in the most. And with time, the cartilage creates scarring in the area, which stiffens the nostril. Sometimes, the surgeon also places a thin strip of cartilage between the nasal septum and upper lateral cartilage, called spreadografts, to widen the space between these two structures. However, if you have flimsy nostrils, it can still cave in despite the use of these spreadografts. Then the skin is placed back down and closed with stitches. Since you're adding a cartilage layer under the skin of your nostrils, your nose will look a little bit fuller on both sides. And rarely, if your ear graft cartilage is too weak and flimsy, then the operation may not work as well, and you need to think about other sources for the graft or choose a different procedure altogether. Another way of lifting the nostril is called the bone anchoring suspension technique, or BAST. Here, a tiny screw is placed just underneath the lower eyelid bone, and a stitch is passed under the skin, grabbing the part of the nostril that collapses, and then looped back around to come out the original small incision and closed under mild tension. The incision heals very well since it's eyelid skin, and there's no major difference in how the nose looks, with very subtle changes. One small study compared the BAST procedure with the radiofrequency stiffening procedure I mentioned earlier and found no significant differences in the outcome, which was positive. A third option is a variation of what used to be called the ALOR procedure, but I modified it without using the implant. Cosmetically, there's no significant change on the outside. If anything, they look much better. I did a fair number of each of these procedures while I was in practice, choosing one over another based on the patient's needs and circumstances. When I started doing these procedures along with Septoplasty and Turbinate, the overall subjective success rates jumped much higher. This was confirmed in a study by one of my former colleagues, Dr. Stuffy, who performed nasal valve procedures along with Septoplasty and Turbinate with much better than typically poor results for obstructive sleep apnea. Like I mentioned before, this procedure can be done along with a Septoplasty and Turbinate procedure, or it can be staged for a later time if the first operation didn't work that well. Number 6. Rhinoplasty is sometimes needed for complicated nasal or septal deformities, whether it's developmental or due to trauma. Rhinoplasty means modifying or reshaping the nose. It can be done for cosmetic or functional or medical purposes, including for cancer. It's important not only to address the appearance of the nose, but also how well it works on the inside, as well as on the outside. Number 7 is palatal expansion, and this may come as a surprise to you. This procedure is done by the dentists, orthodontists, or maxillofacial surgeons to widen the upper hard palate. This will not only make more room for the teeth, but it'll also give you more airway space to breathe in the nose and the throat. Since the nasal sidewalls are connected to the maxilla where the upper molars sit, widening the upper jaws will also widen the nasal sidewalls as well. This is definitely a welcome side benefit to palatal expansion. There are a number of different degrees of palatal expansion. It's commonly done in young children with expander appliances, since the midline palatal suture line has not fused yet. For adults, it's more challenging since the suture line has fused. However, many airway-oriented dentists are using sophisticated appliances which expand the upper jaws anyway. There's a bit of controversy about whether or not you can expand adult hard palates. The more traditional dentists promote different variations of surgery-assisted palatal expansion. Here, you have to cut the midline hard palate suture line and then use traditional expanders where you have to turn a key once in a while. There are also bone-anchored expanders, or you don't see any brackets for the teeth on the outside. One of my mentors, Dr. Casey Lee, uses a laser through the nose using an endoscope to make the cut so you don't have to go through the mouth. As far as I know, there are no definitive studies comparing outcomes between each of these methods. Ultimately, you have to go with someone that you trust. You can do just as great of a job with an older, low-tech option if you're competent and have the skill and experience to get the job done. Let's say that you just saw your ENT doctor and you can now breathe much better through your nose, but you still can't seem to get a good night's sleep. What this means is that you may have what's called obstructive sleep apnea. Something is closing off in your throat while you're sleeping. You may think that addressing your nose for better breathing may help or prevent sleep apnea, but unfortunately, studies have shown that in general, nasal surgery for congestion doesn't cure sleep apnea. If this situation describes you, then it's time to see a sleep doctor to get tested for sleep apnea. But if you still have a chronically stuffy nose, you need to do some detective work with your doctor. You can also troubleshoot by yourself by watching my other videos on how to deal with your congested nose. Or you can read my ebook, How to Unstuff Your Stuffy Nose, Breathe Better, Lose Weight, and Sleep Great. There's a good chance that by reading even 1 or 2 chapters in my book, you'll be able to breathe deeply and fully like you've never breathed before. Imagine being able to keep your mouth closed and wake up more refreshed every morning and have the energy to take on the world. It's an easy to read but comprehensive guide to figuring out why your nose is stuffy and what you can do to take care of it for good. I start with conservative options and then cover much more definitive long-term solutions, including surgery. Stop spending time on tips and hacks that only work temporarily. Get to the root cause of the problem and address it properly once and for all. This ebook summarizes the protocol I use to help thousands of patients breathe better, sleep better, and live much more fulfilling lives. Click on the link above right now for my special offer for $10 off and 3 free bonuses worth $48. There's no reason to wait. If you want to take your nasal breathing to the next level, take action on this special offer to download my ebook now.